right, welcome everybody. I'm your host, David Morrow, and in the studio today, we have the CEO of Aptiva Health, Eric Lowe, who has created a model for a holistic approach in rendering medical care, treating orthopedic injuries, as well as the emotional components that go along with that, which often get overlooked in traditional medicine. A great story of overcoming failures, building a great culture, etc. So we welcome him to the studio, Eric. Welcome,
Yeah,
sir.
David, thanks for having me. I look forward to it. Look forward to the conversation.
Yeah, absolutely. So let's start from the beginning. Kind of tell us, when you were a little kid, you always grew up, well, like you always wanted to be CEO of Aptiva Healthcare. Like even as a little boy, you were like, I know exactly what I want to do. Now, clearly that's not the case.
Yeah, zero
So,
chance.
yeah, exactly. Like, nor did I. It wasn't even like what I do, cybersecurity, AI, stuff like that wasn't even a thing back then. So, walk us through the arc. Kind of tell us about some of the things you want to share with us on challenges you overcame, lessons you learned, and the like.
Yeah, sure. So, I grew up in a small southeastern town just south of Louisville, Kentucky. Not really a bustling metropolis. I think at the time when I was growing up, probably one or two stoplights, maybe a Dairy Queen. That was about the height of our downtown area.
Good, wholesome.
Yeah, exactly. So I had, my dad worked on the line at GE and had a mom that was a substitute teacher, really meager means. As a young child, I had, great faith foundation. My dad helped coach me in Little League football. Both my older brothers went to the military, one the Air Force, the other the Army.
That's great.
But
That's
yeah,
awesome.
that was part of growing up in a small town. Dad had a clear directive for us that at 18, you're out of the house. Either you go to the military or you get a college scholarship. So I was fortunate enough to play football, and despite some mistakes I made in my past, was able to play in college, and then went into law school, and kind of through happenstance met a doctor while I was in law school, just helping him move a couch, and we started talking.
That's where I
And
meet most of my doctors.
yeah,
It's usually
exactly.
the personal ask
Yeah,
that I'm like, all right, great. Like, can you call in that script, by the way, while I'm
yeah.
moving this couch because you just hurt my back. So
Yeah,
anyway,
yeah. His nephew was my college roommate, and we played
cool.
together. So he knew, two big guys can move this 1980s couch that weighs 3,000 pounds by
Right.
themselves downstairs. And we just started talking, and that was right around the time post '08 and 2009, 2010, where a lot of the economy had just changed drastically.
Yeah.
When you're in law school, they talk about the big firms are the one that hire, and that's where
Yeah.
you
The
want to
silk
go.
stocking firms, everybody is trying
Exactly.
to gun for those. And there's so much opportunity in the smaller ones where you can actually do more,
Yeah,
right?
yeah.
Especially then.
So at that time, they just had stopped hiring, and we had a conversation, kind of registered in the back of my mind, and then as things kind of proceed in life, I looked a year or two later, still had his business card, reached out to him, and that's really how I broke into healthcare. He went from being a
Awesome.
general surgeon to relying on his first board certification of physical medicine and rehab. Wanted to start an outpatient clinic, and I told him I think I can help, and that's really how I got my foot in the door. And a lot has changed since then, and I've grown quite a bit, and that was before we started Aptiva Health, but that's really how I got my start.
That's cool. What type of like entry level role did you start with?
Yeah, so when I came in with him, it was both from a marketing standpoint, help building the business, and from a revenue cycle standpoint.
Okay, revenue cycle management, things like that.
Yeah, yeah.
That
So
is that is the collection, the coding, the all of that, because that is so huge in healthcare that people outside of healthcare don't realize. Like it is such a there's the treatment, but then there's the coding of it, there's the insurance, there's the outside amount, reimbursement. It is so it's requires quite a bit of attention in a medical
yeah,
practice.
and what I found, and credit to him for having the insight, that we found that a lot of people that do revenue cycle management, and no slam against them, but a lot of them have limited experience and knowledge when it comes to law and interpreting contracts.
Correct.
And when you're talking about having contracts with insurance companies, being a network provider and navigating, those waters, it really helps to have somebody that has that training to be able to interpret those contracts. So that's where he plugged me in at first. And I was really able to help change. I was able to not just see, the structure, but what we were doing wrong to change some of those things that really helped bring in additional dollars to the practice, and then build out some processes that we were able to replicate that really helped him grow. So that's really where I got my start. And then the other is,
Yeah. Yeah. I
you know,
mean, and when revenue cycle management is done right, I've seen it where it makes healthcare more affordable for people. Like it gets things covered that the insurance company may just blanketly decline. And because you have an advocate there. And then it also generates real revenue for the physician. So from the patient physician standpoint, it's really like having a good RCM, you know, model is really, really effective. Just wanted to
yeah,
say that.
yeah, it's huge. I mean, to be able to get things pre-authorized that patients need, and knowing,
Yeah.
what to put in templates to be able to get those things approved. And then on the back end, making sure that you're coding and you're collecting. And where the process breaks down for a lot of people is they just haven't built out systems to be able to collect those difficult dollars in accounts receivable.
Yeah.
So that's where he plugged me, and that's where I got my start. And then being on the marketing side, seeing what was really receptive in the community and receptive to other providers, kind of, created that light bulb moment for me that, hey, you could really build something special here that's differentiated in the market that serves patients better, faster, and more affordably. And that's where the kind of the idea for Aptiva Health started.
All right. Let me ask you this. When you start out, you're a young buck and you go to this guy who lets you break in. Were there any lessons that you learned or anything that you learned about the culture there that you were like, if I ever start a business or in my life, I want to reflect this type of culture, or the opposite?
Yeah, I'll give you two that are, polar opposites. One,
Okay.
with the doctor, he had a phenomenal way with patients. He
Excellent.
was one of those guys that went above and beyond, not just in the patient exam room, but following up with patients, checking how their grandparents were doing it, if they shared something personal. So it was really important to me to see that deep connection that he had that was beyond just healthcare. And it resonated with me, saying, healthcare can be a lot more than just treating somebody's symptoms or, giving them a diagnosis. It can be a real way to connect with people to bring, a meaningful exchange. The opposite was true for his business partners. So he had two, business guy partners.
Wow.
And in my mid 20s, they had country club memberships and would be taking people out to steak dinners, at the high price steak places. And,
Sure.
so what I saw over those, 3 years that I worked with them before I started Aptiva Health was what happens when you extract all the value out of a company rather than reinvest. So that also resonated with me just as deeply, was how much further and bigger and more people could they impact if they just weren't spending like they were spending.
Right.
It's like taking every dollar of profit out of the company to live the
I see it in
lifestyle they
small
wanted.
business all the time, right? Like
Yeah,
you start petrified you're going to go out of business. Phone's not ringing, right? So then you fix that, and then the revenue starts coming in, and then you're like, all right, we've made it. And then you just
yeah,
start spending and you start living that lifestyle, etc. And that's not, it's really short-sighted,
100%.
right? And the point is if you maintain what you have and you take all that extra and you reinvest it
Hmm.
into infrastructure, future plans, marketing, larger client, region, expanding the geography of treatment, like all of those things, then you build an even bigger model, in which case your lifestyle can improve like incrementally, but it's more stable, right?
Yeah, yeah, it's you're picking up pennies to cost yourself dollars.
Right.
You're
Exactly.
just pulling out that the upfront value instead of creating that compound interest down the road.
That's a personality thing, though. I mean, like people in business, I still think the vast majority of people are good, right? But you've got some people that just, focus on them, right? And so, you are who you hang around with. And
Great.
like, as I tell
Great.
my kids, like, I'm sorry, but you are who you hang around with, right? And
Yeah.
it's a really strong reflection. So, so how did you? That was the first part that you saw about the culture. What was the second part? I want to ask you how you came up with the idea for Aptiva and then how you launched it. But before we get there, I want to go back to those two cultural moments
Yeah. So
in the first role.
the second part was really, like I was talking about them extracting instead of
Yeah.
investing. So to pull on that thread, where I saw the opportunity was from an operational perspective, in that at the same time I was with them, I saw opportunities that they weren't capitalizing.
Hmm.
They had
What
all the
type? Like what kind?
Sure. So medical legal consulting was a big one. So
Yeah,
yeah,
love that. Back
yes,
from my personal injury law days.
yeah,
Like that is the bomb, right? Like that is
yeah.
the key.
So you have the providers, you have insurance companies, you have attorneys, you have, all these people that
Yeah.
need a physician that can render an opinion, that can be
Review
unbiased.
the nurse to review the records, somebody to extrapolate it, and somebody to, to have a medical opinion that supports an injured person or the other way around for the
Right.
insurance company, right?
Yeah. So they had, all the physicians, and they, were working with patients that were injured at work, or different, with physical medicine and rehab, you're seeing a lot of injuries. And, a byproduct of that is you're working with some of those attorneys or some of those insurance companies or some of those employers. And I, kept kind of pushing them, like, hey, what are we doing when they request an IME? What are we doing when
Right.
they request records reviews? And they're like, well, we
For
don't really.
listeners, an IME is an independent
Yeah.
medical exam. Just
Sorry.
so that you know, when there's somebody injured in an accident, the insurance carrier or the defense of the company will always request through the court an independent medical exam, meaning their medical doctors treated the patient. They say they have this. We need an IME. We need an independent medical exam, and that person is basically going to say there's nothing wrong with the person, right? Like basically like they're paid to say, there's nothing wrong with the person. And then you have the battle of the experts.
Yeah. Yeah. One side says they can never work again. One side
And one
says,
side says like they
yeah,
don't have an arm, like they can't work. You know what I mean? And the other
yeah,
side's like there's other jobs they could have. They're fine, right? And
right.
it's sometimes it's extreme. So
Yeah. And that's where I saw the opportunity,
yeah,
where
because it's needed. Like the
yeah.
system is already there and it's happening. So you need to support it.
And just like, if you're able to connect with patients and be fair and unbiased, and, have a culture that shows that you actually care, if you do the same
Oh yeah.
thing in that work where you're just fair and unbiased, I mean, just from you've been in that world, if you find a good doc with a good CV that actually says the truth, a lot
Right.
of people are going to want to work with that doctor.
100%. And you see that happening, right? When somebody comes out and they're like, and people get frustrated, like both sides will get frustrated. But if they're on the side of the truth and they're being objective, that's who you want because it's really tough to persuade a jury not to believe that person.
Right. Agreed. So, in that group where I was still the young guy, and they just kind of dismissed those ideas. And, that's where I started my first side hustle. So I said, okay, well, can I
Nice.
get your blessing to do it myself?
Yeah.
I'll do all the grunt work. I'll do the marketing. I'll do the admin. I'll get all the records together, start this medical legal thing. And they were like, yeah, as long as it doesn't take away from your, daytime job. And that's really how I got started, was doing that, and eventually met my current partner, Dr. Yoon, through that same. He was doing that same type of work while I was an ER physician. And he was working with a lot more insurance companies, and I was doing kind of the plaintiff side of the bar. And
Yeah.
we both were tackling it with the same perspective of, get credible, honest, unbiased work product, and the work
Right.
will follow. So that's how we first got together and partnered.
So cool. Very cool. Um, so how did the idea, let's pivot to Aptiva Health. First, let's
Mhm.
explain to the audience what it is because it's different than a lot of just orthopedic care places.
Yeah, so Active Health's a multi-specialty group. So we're independent in that we're not hospital owned, we're not private equity backed, we're truly independent. But we have everything from immediate injury care. If you have, a lot of people will call it like walk-in orthopedics or urgent
Right.
ortho. What we found is just, I would rather somebody go into Google, understand injury care, than try to figure out what an orthopedic surgeon does. So we do that. We have general orthopedic surgery, we have sports medicine, we have orthopedic spine surgery, pain management. We have physical therapy, advanced imaging with MRI. And then we also have psychology, psychiatry, neuropsychology. We have 2 fellowship trained neuropsychologists from UPMC, the top neuropsychology fellowship for concussion testing and treatment. Dr. Collins, who developed the impact testing for NCAA and NFL.
Oh yeah, for the head injury. Oh yeah, famous actually. Yeah, that's
Yeah.
phenomenal.
So
That's great.
so 2 of them work for us. So we a lot of different specialties, but everything from what we try to treat as, a holistic approach to musculoskeletal care. So head to toe, any injury, whether it's psychological or physical, we can handle it.
So I'm sure that was super easy to put together. You thought of it and you were like, "Yeah, I'll start it Tuesday. I'm sure by Wednesday we'll be up and going and profitable." So how did the idea happen? Like, how did you first have the idea, and then what were the initial steps you took?
Yeah, so a lot of it came from my experience working with that first group and then starting the medical legal consulting company. So what we found was my partner, Dr. Hune, he had a lot of orthopedists and different people he knew because his group ran 30 ERs throughout the state of Kentucky and in Indiana. So when you run an ER, you have to know who to refer to once that patient gets discharged.
Right.
So he had contacts in the orthopedic world and neurology and all these different specialties that we needed. After the first year of us doing that, we had enough requests from people saying, well, what about treatment? We can't get anybody to treat these patients, that we looked at each other and said, we could probably do it. So he then reached out to a neighbor of his that lived in his neighborhood about renting some space from him, a practice in Georgetown, Kentucky, which was about 25 minutes from Lexington. And that new practice, he had a couple days a week they weren't using, but it was a former Porsche dealership, super nice. He had an MRI that was there. He had a pain management suite that was there. He had physical therapy that was there. And his partner was a general orthopedic surgeon, and he was a spine surgeon. So a lot of the pieces were there.
In a different model.
Right.
And you guys were like, here's our model. And you go and you bring that proven model into those practitioners.
Exactly. So we integrated it directly into his practice. We added the emergency medicine. We added some of the other things. Right. And the way we got started, because we didn't want to take, huge loans and, be in debt up to our eyeballs, we took the proceeds from the medical legal consulting company, used that as our seed money. And then we were able to negotiate with him, hey, we'll come in, we'll create this model, we'll improve the patient flow, we'll get you busier, we'll use space that you're not using, and we'll guarantee you payment. The only catch for us was it was 90 days. So we had 90 days.
So it gives you a buffer to manage the cash flow.
Exactly. So we had 90 days of deferred rent and 90 days of deferred payments to all the providers for everything we did. The benefit to them were all the things I said before, plus it was guaranteed payments. So they were in a no-lose situation. If you can wait 90 days, but somebody's guaranteeing those payments, a lot of people, especially in healthcare, will take that deal.
Yeah.
Yes.
That's interesting. I don't see that a lot. I don't see the deferred payment. That was smart. That was really good.
At the beginning,
nice move. That was shrewd. I like that. Yeah. That's pretty good.
And it came from, that experience working in revenue cycle management. So we knew
I was just about to say, I'm like, did you get that idea from RCM? Like, that's probably exactly where it came from. That's phenomenal. That's phenomenal. So today, who all are you serving? Your group services the public. Do you work hand in hand with, with law firms and expert testimony anymore? Or
yeah, we still do that.
That's all part of it too. Yeah. Because once you get into that, you can never really let that go. It's exciting.
Yeah, 100%. A lot of the physicians like it. So what we did was we created a lot of templates and models and everything. Sure. So like the AMA guides to impairment, we have a template for every single thing that's rateable under that system. We even have some AI technology that we use with an iPad Pro that can do exact range of motion measurements, all that stuff. And it's videotaped. So it's really accurate, saves a ton of time.
Oh, that's fantastic. And then and that's a render that you can then provide to counsel, and they can show a jury, right? Or an insurance agent, right? Or a defense counsel and say, no, look, they have a limited range of motion. You can literally see it. That's so much better than in page 468 of a
Right.
medical record. You're like, apparently there's limited range of motion, but nobody's talking about it. So move on. Right. It's
Right.
really important. Oh, that's really good. Well
Yeah.
done. Well
Appreciate
done.
it.
You've really thought about this. That's great. So today, how many employees do you guys have? What's your culture like? Let's talk about it.
Yeah. So we're up to about 180 employees.
Holy
We
cow,
have,
that's a big practice. Like
yeah.
that is a big ecosystem.
Yeah, we
That's
have,
great.
I think, as I counted earlier this week, we have 2 new providers coming on, but right now we have 44 providers, from physical therapy to physicians to mid-levels to
Wow.
psychology, psychiatry, neuropsychology. And we have 12 current locations. We have 2 locations, one that'll open in April, one that'll open in May. One is actually my hometown, which is, pretty rewarding because, you get to go back to an area and be
Get to
there
go
to
back
help.
to high school, be like, how you guys doing? Remember me?
No,
That's
no.
right.
Still got to put on my boots and cowboy hat for
Yeah,
that.
exactly.
But it's good to go back and help, and then we have one in Indianapolis that'll be our
I
first
was
big
just about to
hub.
say you're opening something, or it's not open yet, right?
No,
Or
no,
okay,
yeah,
because
it'll
I'm
be
excited.
open.
I'm in the South Indianapolis area, so
Yeah, so right off Southport is
oh
where
yeah,
we're going to be, right next to Sky Zone.
oh yeah, it's right where I am. I'm over in the Bargersville, south of Indy
Okay,
area.
yeah,
So, well,
so
that's great. Now I know if I slip and fall where I'm going. So that
100%.
is fantastic. So let's talk about and I mean that. Like I will literally,
Yeah,
I will text you.
yep,
I'll be like, dude, I'm on my way, hurt myself. And you're like, oh my God, I better warn them. He's
you'll be
going to be
fine.
a handful. No, I'm very polite. Talk to me about the model, because when you and I had our prep call before this, I was really interested in this. You guys don't just treat, because when there's an injury, what a lot of people don't realize, and they'll realize it if a family member has gone through this or they themselves, but there are a lot of psychological ramifications that come with a physical injury. And for years, I'm older, right? So for years, nobody cared about that. Like they were just like, it's your leg, suck it up, get back to work, right? Now that we've evolved a little, like we kind of are starting to treat the whole person, which has really helped because it helps the physical ailment heal faster as well and more permanently. Walk us through that. Why is it so important to also have neuropsychology, psychology treatment, and therapy alongside the physical injury?
Yeah, so one of the few things that was actually a positive coming out of COVID is that the mental health crisis was a lot more in view for everybody.
It was huge. I think
Yeah,
it bubbled to the surface for a lot of people.
and that's really where
So
we
many people went nuts. Like I don't mean that in a dismissive way. I mean like there is something about not socializing at all for a year that really played its part in culture in the United States.
Yeah, I mean, it was true in objective data that we had in
Yeah.
that prior to COVID, especially with orthopedic patients, you didn't hear a lot of the I'm anxious, I'm depressed,
Right.
I don't, all those additional stressors that are psychological in nature. Post COVID, it was in over 60% of our patients. There was some mention
Wow, that's a
of
huge
some,
step.
yeah, and some aggravating psychological factor. And then that really compounded and was brought to the forefront when we brought in Dr. Mandarina, who's our head of concussion care. So, her background in neuropsychology at UPMC, she knew, and there was research published on it from their program, that patients that had a pre-existing, either diagnosed or undiagnosed ADHD, PTSD, anxiety, depression, had a far more prolonged and protracted recovery from concussion care than patients without them. So, one of the things that we started looking into was how long is it going to take us to get in these patients that have concussions but have these underlying psychological diagnoses to get the treatment they need? And the average wait time in the market was 6 to 9 months.
Are
Well,
you kidding? So
yeah,
back then it was really that. So you identified that void
yeah,
and you're like, this needs addressed.
100%. So that's where it started, was really, and that's how we do everything is, solve the first problem. And then as the next problem, as you identify it, let's solve that problem. Let's continue to solve that
Yeah.
problem. So what we've done with our mental wellness department is really not just address it from concussion patients, but all injuries. What we see, especially with athletes, with injured workers, especially if you have a major work injury and you can't go back to provide for your family, there is a major psychological component to
Well,
that.
think about it from just break it down. Forget the medical practice. Just think about it. If somebody is a worker in a trade, right? They've gone through apprenticeship. They've spent their family is in it. They are like all their friends are affiliated with it. When they're injured and can no longer do that, that is an identity crisis as much as anything else. Same thing with athletes. I mean, like when you see a certain level of athlete, right? That is their identity. That is everything that makes them them, right? And when their physical injury occurs, there's a lot bigger fall than just the bad knee or the bad back.
100%. Yeah. And what we're seeing, and especially, as NFL athletes come out of the league, they're having them go through a whole process of how to, it's almost like veterans. When you're coming back from deployment, you've got to see somebody to, how do you get back to integrate into society? Because the, Sunday almost worship of who you are from 100,000 people under the lights, and you're the most important person in that moment, to nobody even knows who you are. I mean, that's a major psychological shift.
Yeah.
So we just identified and like you and I discussed, in the pre-meeting, not only have we focused on those things, the other thing is the patient that's identified by one of our surgeons, that they believe, and surgeons are really good at this. They can identify a patient and say, I don't think they're going to do well, simply because of how they perceive this injury or this surgery to impact their life. And it's the whole, it's the whole change of perception of, when a patient has the anchor on I'll never be the same versus I'm going to get back to my life, it completely changes the outcome. If it's that perception of I'm never going to be the same, I'll never, be able to do the things I love, they're going to have a bad outcome. It doesn't matter how good that surgery goes. They went into it with that false perception. So what we do is send them through a mental hardening process. The 2 weeks leading up to surgery, they meet with a psychologist. They go through all those different steps to try to change that frame.
They get prepped for how you're going to get back to the way, even if it's altered, it is still a higher quality of life than you're anticipating.
100%. And then we follow them up.
Key. And so surgeons are good at spotting that, you said.
Yes.
I wonder why that is.
So I think it's just anything in life, you get really good from reps. So you do something for 15, 20 years, you start, identifying, here are the common themes from people that aren't doing well, especially. And there's nothing more frustrating to a surgeon when you've checked all the boxes about their BMI isn't high, their age is good.
Right. And you have a good surgery. You've done everything from a surgical perspective, but yet the patient isn't better. Because then you're like, so that's really helpful even for the surgeon.
100%. I mean, they love that teamwork approach, and that's everything we do is that teamwork approach. So we have, our physical therapists are talking directly to the surgeons are talking to the emergency medicine and generalists, all the teams talking to the mental health team. So when you have that team approach and care, everybody knows your story. You're not just another number on a chart of 50 patients somebody's going to see. They actually know who you are, your story, and what we're trying to do from that team approach to get you better and back to life as fast as possible.
That's phenomenal. So let's talk a little bit about AI technology. How has AI in particular played a role or altered kind of how your staff is implementing treatment, taking notes, researching, things like that?
Yeah, so we're very, very tech forward. I've, our CTO, actually, it's funny. He got a degree, an undergraduate degree in AI in the 90s. Like, that's how long AI has been around.
Yeah.
It's just made these massive jumps from, language processing and the LLM models in the last couple of years. And in the last, 18 months, it's made exponential jumps. But we integrate it from everything from front end. So when we're doing transcription, Whisper that was developed by OpenAI. We've developed our own. We use an ambient AI scribe that you can use in the room with the patient, and then we've actually developed our own that we can still use the electronic dictaphones and directly upload and have it available right away.
And it's all kind of sandboxed and secure so that it's HIPAA compliant. Right.
Yes. So we use our Azure instance for a lot of our stuff that's
Excellent.
within our, own Microsoft environment. And then we have an enterprise account with, OpenAI and
Yep.
utilize ChatGPT and specific GPT models with guardrails set up against them. So you can't upload or
And I
ingest
think we had
PMI.
this
Yeah.
discussion in the prep call. I'm like, I can't tell you how many healthcare providers I talk to that have none of that.
Yeah.
Like they have none of that. So for listeners, this is a really safe place to go to and get medical care because your privacy is thought through, right? I mean,
Oh, yeah.
it's so important. But a lot of them don't invest. Again, they're not investing in the infrastructure and building it right. Because if you go incrementally and you go slow, it'll last longer, right? Like you're able
100%.
to build it, and once you build that model, then you're actually able to scale like you guys are doing now.
Yeah, and the company knowledge portion of OpenAI with the enterprise account is really amazing. I mean, when you're able to link it to your share drive or your Google Drive if you're using Google, the more you use it and the more independent GPT models you have, the more that knowledge base about your company grows over time. And what it's able to do functionally is really amazing. I mean, it can
Well,
answer
yeah,
questions, do tasks, everything more efficient.
right. And the just the ability to cross reference different aspects, right? I mean, when you think about once you have that ecosystem built, because I use it, like I was telling you, I use it every day, and we've built it up to the point we use a sandbox
Hmm.
compliant, SOC 2 compliant AI, and it gives us access to all the different LLMs and the ability to build out a model that can cross reference, right? Like
Hmm.
you're like, well, we've seen this before. Let's take this piece from there, this other component from there, and then you're able to build something new right from it. And I imagine wholeheartedly in the medical care arena, you're able to say, with this injury, we've seen this type of psychological impact. Give us insight on similar instances that we've treated without disclosing, the patient's PHI, but the trends and the findings from that. And you're able to
Yeah.
pull all that.
Yeah.
And that's great medical care. That's modern medical care. It's really good.
Yeah, I mean, when you have a historical basis of 60,000 patients and it can ingest and it can see the trends and it can help you formulate decision making. I mean, one, it helps to corroborate the things that you're doing and validate them. And two, it helps with predictive analysis. That's where we've
Right.
seen it be incredibly useful. And that's where we've implemented Kinetisense, like we were talking about before. So that iPad Pro that does the digital range of motion measurements. So now when we see a patient new to our practice, if it's a new orthopedic patient, if it's new for physical therapy for the first time, we want to capture all those range of motion measurements from day one. And then at follow up, when we reevaluate, we want to be able to capture them again. And then at discharge, so we can show the patient. And then we're able to take that information and then share it with payers, share it with employers, share it with people that we do business with to show, hey, not only do we say we do a better job and we're getting people better faster, here's the proof, and it's
Well,
documented.
yeah, and what's nice about that and what's nice about the 3D modeling and the visual aspect is different people receive information different. We learn in
Hmm.
different ways. And
Right.
historically, it's just been a handwritten check mark hash circle on a pre-printed black and white form, right? And
Right.
now you're able to demonstrate that across platforms visually and historical basis for it as well.
Yeah. and
That's
and
phenomenal. That's really good. That's really impactful.
Yeah, and I mean, it just leads to better patient care, and most patients like to show people. I mean, I like I said, I played football in college, and everybody has the X-ray from where they broke something or tore something. They're like, man, look at how many screws I got.
Yeah.
So when you have the video and you're like, look how bad it was, and now look at me, I can do all these things. I think it's
What is it
impactful.
about that with the with my football friends like that have that? There's got to be something in DSM eventually. Like, you know what I mean? Like this is the imagery whatever,
It's same with
way of
vets.
doing
Same
it.
with vets. I mean, everybody's got a story.
Oh yeah. Exactly. Well, it's a trauma again, it's one of those physical events that affects the identity, right? Like it really goes to the heart of who the people are. So, well, that's phenomenal. Well, hey, Eric, what's the biggest challenge you guys face right now? Because it's incredible what you've built. And yeah, I mean, you're not a medical doctor. You didn't grow up to be a doctor. You weren't thinking this from a young age. So it's a remarkable story how you wound up where you are. So congrats. Like, it's
Appreciate it.
phenomenal. So how, like, it's not, you got good days, you got bad days. Like, what are some of the bigger challenges? Is it the industry? Is it the insurance industry? Is it the expectation of patients? Like, what are some of the bigger challenges that you guys are looking to overcome in the near horizon?
Yeah, so I think healthcare is unique in that
Yeah.
not only are you dealing with insurance companies and competing against large hospital systems, but there's also a governmental and legislative component that is incredibly impactful and can change at the whim of legislators. So we're
Yeah.
seeing that with some state legislation, and I know a lot of hospital systems are dealing that with the potential fallout from the big beautiful bill. When you're and unfortunately it's necessary.
Right.
I'm a small government type guy, and that's tough to be when you're in healthcare.
When you get affected by it. But you know it's the right thing. I'm
Right.
the same way philosophically. Like, no more dangerous in history. No more dangerous words have been said than "we're from the government. We're here to help you." Like,
Right.
that is those are frightening words. And for those that don't agree, just live longer and it'll prove it to you. I don't
Yeah.
have to say a thing. Like,
Yeah.
but there's some pain that has to happen, right? With it, there's some self discipline and some restrictions that we have to have that freedom and that sovereignty.
Yeah.
So that's clearly a challenge that you
Oh,
guys
yeah.
have to deal with.
Yeah,
Yeah.
it's a definite challenge, and it's we're doing things differently than just about anybody else in healthcare, especially in our region.
Hmm.
So when you're constantly the outsider, at first it's met with you're not going to make it. Second, it's measured with, well, you can't be doing things the right way if you're still in business and you're not doing it like us. And then now it's, wait a second, what is it that you're actually doing, and how can we make sure that we can compete with you? So, but the benefit we have is we're a lot more agile. We don't have all the bureaucratic
Right.
red tape. We're not a major system that has to do
And
all
you're
those
leveraging
things.
technology to have insight on that too,
Right.
right? I mean,
Right.
with your systems, you can keep an eye on where the trends are going in your field outside of your ecosystem. You can see and have sensors going on and get good business development intel.
Exactly. And where I see things going, I honestly think it's going down three paths. You're going to have insurance owned, and you already see that with Optum and how Optum owns SCA, and they own a bunch of practices and they're developing their own networks. You see it with CVS Health, that CVS bought Aetna, and now they have CVS Health and they're rendering care. Then you have the hospital systems. You have the major hospital systems that have cannibalized all these independent practices that are insourcing, and they are capturing patients and kind of holding them in their system.
Right.
And then the third is where we're going. And the third is direct to patient, direct to consumer, and to self insured employers, because self insured employers and their employees have a commonality interest. It is, how do we keep people healthy so that they can work and produce? And how do we get people in healthcare and get the care they need at a lower cost so it's affordable to them? So, our current incentive and what we've been doing is negotiating directly with those large self insured employers and brokers and doing bundled surgeries, doing direct contracting, creating a tier one provider service for Aptiva Health. So, if an employee needs anything that we provide, if they come to Aptiva Health, there's no copay, there's no coinsurance, and there's no deductible. So, if you need spine surgery, and you can have it done by one of the best spine surgeons in the nation, you can come to Aptiva Health, and if you're part of this network with a self-insured employer, you pay nothing. If you go
That's
to the hospital,
outstanding.
yeah,
That's outstanding.
yeah,
Yeah, if you go to the hospital, even your copay or your deductible,
you're going to pay it.
etc., can be astronomical.
Yeah, and we also see over 100 patients a month now that are self-pay. So if you go to our
Yeah.
website and go to Aptiva Health /affordable dash options, every single thing that we do, it shows the price. You can click on the button, you can buy it right there from your home, bring in that alphanumeric voucher, and get the service that you already prepaid for. So an MRI right now is $299 at Aptiva Health.
That's incredible because people will go to the hospital. It'll be $10,000. Their copay will be $900, but here they could pay $300 and not have the cost, etc.
Exactly. And it's everything. It's not just an MRI. If you go on that page, you can search all the different things.
Because you get rid of all the nonsense, right? Because so many people see the bill. They're like, I was in for 3 days. My bill's $200,000, but really it's this, but then it's this, and then I still have to pay this. It's so confusing because there's so much like reimbursement and copay, and it's all this accounting stuff. It's all that revenue cycle management part. Like it's all that a patient is just perplexed by.
Yeah, we say it's intentionally confusing. I mean, it's the only system.
They do it intentionally confusing. Yeah. That's what the model is based on.
Exactly.
Right?
Exactly. You got to get that EOB that shows the charge was 5,000 and we negotiated down to 3,000. And now
everybody has different metrics. They all have incentives for getting numbers certain ways. And it's crazy.
Yeah.
So that's phenomenal. And you guys do a lot with virtual care, don't you?
Yeah, we do.
And that's virtual. And I think that is just a phenomenal idea because there's so much virtual care is gone a lot. It's a lot better than just the historic traditional telemed, right? Where you get a doctor on the phone and they're like, well, we really can't do anything because I can't see anything. Just go to the emergency room. You're like, well, that was kind of a waste of time.
Yeah.
Now it's totally different. Like now they're able to do almost like so much more, and they're able to get on video and everything else. And they're able to call in prescriptions or order a test or whatever and continue the medical care from the comfort of your home or at work or wherever you're going.
Yeah, no, we do all that. And one of the best partnerships we have is with the Herd app. So the Herd app is literally an app you can download. It's free. So if you ever get hurt or have an injury or have an orthopedic condition and you want to be connected to an orthopedic surgeon within 3 minutes, you can do it for free. And what they've shown over the last 5 years is they've reduced 98% of unnecessary ER visits for orthopedic injuries. So
that's phenomenal.
A lot of times you fall and you hurt your knee, you hurt your shoulder, you hurt your back. If you go to the ER, I mean, once they know you're not going to die, they're sending you home. And they're going to say, follow up with your primary, follow up with orthopedic, and then you got to get that extra appointment. If you use the Herd app, they're able to connect you, make sure that you're not in need of going to the ER right then. And then they connect you directly with us so that we can either see you right then if we're open or first thing the next morning. So you didn't waste that time. You didn't waste all that money going to the ER when you didn't need to. And we're able to capture all that information ahead of time, get you in as quickly as possible, get the diagnosis, and get you on the treatment plan you need to get back to life.
That's absolutely phenomenal. Now, do you guys do things other than orthopedic? I know that's your specialty, but if somebody needed the mental health care, they could come straight to you guys, right?
Yep.
If somebody needed ongoing neurology care or something like that, you have the specialist.
We do. Yeah. So whether it's mental health, whether it's neuropsychology, psychology, psychiatry, if it's just a MSK condition, physical therapy, we even have athletic training. We have a lot of partnerships with different schools and athletic programs, all those things that we can handle. And that's what we do. And then we also have a wellness. We have a wellness side as well. So on the wellness side, we have primary care, concierge, and it's all a direct primary care model. And then there's some hormone optimization and weight loss and things like that for people that need those things. And we've seen that be a tremendous benefit, especially, if somebody needs a total joint replacement, insurance companies will not approve it if you're over a certain BMI. So having that wellness department.
So you can go and get them in shape and reduce their weight, etc.
Exactly.
That's great. That's phenomenal. So what's on the immediate horizon? Do you guys speak at any events or, are there, you guys go to conventions, the HIMSS organizations, things like that?
We do some of the organizations. We do have our physicians go and speak at different engagements. We do a lot of lunch and learns. Yeah. I've just in the last month started doing the podcasting. So that's one of the ways we're growing the brand. Yeah. Trying to get the word out.
Yeah. Well, I think it's a great medium, obviously. I dig it. But that's great. You're on the horizon is outreach, getting the community to be aware of you. We will have links to Aptiva Health in our show notes and in our description here. and we encourage everybody to check it out. Eric Lowe, thank you so much. Great story, like great arc, great career arc, as well as what a great offering that so many people can benefit from.
I appreciate it. Yeah, I'll have a book coming out this year, Be the Broker, that goes through a lot of that memoir and then discusses a lot of what we call the broker framework that we created.
Really? Oh, we'll have to, you are formally invited back as soon as that book, is about to be released. It can go right on my bookshelf there.
I like it. I'll definitely get you one. I like it.
Yeah, I love it. If you can sign it, I would love it.
Yeah, for sure.
Not that you have to. I've got them up there that aren't signed too, but
yeah,
I would love to have it. So yeah, definitely obviously we'll stay in touch. But Eric Lowe, thank you so much. Aptiva Health, we encourage people to check it out. You can be anywhere and check it out because there's virtual care and they will take care of you straight away.
Absolutely. David, thank you for having me. I appreciate it.
Thank you, sir. Great discussion. Thanks.
Absolutely.